So testosterone, you've told us, the specific things which need to be eliminated or looked at when you're bringing this about in the discussion. And then in the rapid fire, you mentioned that injections are the most common formulations. So can you enlighten us with just more insights on what are the formulations which are approved, what are available, and then what are the usual go-to ones, or any pros and cons with either of those?
So when we're talking about injections, there's traditionally two forms of injections that we recommend. The most common really is testosterone cypionate, which the half-life is about 7 to 8 days. And it's given in vials. Traditionally, and I think it's really important to understand the half-life of these medications because they really dictate how you use them. So personally, I think when you have testosterone cypionate, the best way to do it is to inject it on a weekly basis. We just heard the half-life is 7 to 8 days. So why is that important? Because if I inject on a Sunday and by you ask your patients, they will feel by that next Sunday, they feel much lower than they did before. And it's because that half-life is about that time frame. And that's why like a lot of people come to me and they're on the appropriate dosage. They're on about, I do 100 milligrams a week is where I start. Now everyone is different. We can lower it, we can raise it. That's traditionally how I like to start. But a lot of patients come to me, they're on testosterone cypionate, but they're not happy with how they feel. And I ask them how they're taking it. And their provider often says is doing it one injection, 200 milligrams every 2 weeks. Now, although that is equivalent, if you understand the pharmacology here, you know, you're going to be blasted off to the moon for that first week. And you're going to be coming down pretty hard on the second week that you just don't feel even keeled. And I think then if you understand the half-lives, getting to that steady state of where guys are able to keep a consistent level of testosterone for the most part is important. And that's why I encourage people injecting once a week with testosterone cypionate. Now, the other one that a lot of younger people like to do, a lot of bodybuilders tend to do is test enanthate. Now, test enanthate, you can still get pretty much anywhere. And honestly, the truth is both of these can be injected IM or sub Q realistically. Um, but IM is in your muscle, sub Q is like in your fat in your belly. Test enanthate actually it has a half-life of about 4 to 5 days, and people therefore take it about twice a week. Some people think it may have like less water retention. To me, every one of my patients who's on it, I feel like they're the same as the other patients that are on cypionate. But some people like to take that medication instead, and I'm happy to provide it. But the gold standard is typically testosterone cypionate, not an enanthate. The other option is also testosterone enanthate, which is actually an auto injector called Xiasted. That's subcutaneous as well into your belly. Some people don't like needles, so they take that injection, and that's once a week, and that dosage can be adjusted as well. But the enanthate in the non-commercialized version, I do twice a week. For the Xiasted, I do once a week. That's the recommended way to do it. So those are the most common injections. Cypionate's usually the best one, in my opinion, just because of how cheap it is. You can get it quite easily, quite readily, and especially using coupons like GoodRx. I usually don't recommend patients go through the insurance process. It's very painful. Just use the coupons. Androgel, which is the testosterone gel, I think that you need a specific kind of patient. They have other contraindications that I think are you have to be aware of when you're counseling patients. First off, anyone who works outside, sweats a lot, I never recommend androgel because how it works. Well, androgel is absorbed, through your skin. You typically put it on. It's in a clicking machine. You put it on your shoulders, so it's absorbed pretty much directly into the muscle of your body there. That's why you don't want to put it on you anywhere with a lot of fat, so it's more readily absorbed. But you typically do it once a day. I say, however you prefer. I think I would prefer to do it in the morning, but some people like to do it at night because your testosterone levels are highest actually when you wake up. So some people feel like they get that boost in the morning when they wake up, but I'd rather just do it in the morning. But but that's here or there. I typically recommend they do it after they shower, right? So if you shower in the morning, you dry yourself off, put it on, you're good to go for the day. Same thing at night. But if you sweat a lot, you work outside, you're not going to be absorbing the medication as well. So I don't think it's a good option for you. If you're very overweight, where you have like a lot of fat even on your shoulders, probably not going to absorb well, not a good option for you. Another thing that we don't think about enough that I always ask is, are you around, especially here in Florida, California, you probably have it too. A lot of people were shirtless a lot, right? Because the weather is pretty good. So I always ask, are you around children? Do you have young kids that you carry? Do you have grandkids that you carry or hold? And sometimes if you're shirtless, because remember, the biggest concern here and the biggest risk is not to you, it's to the other people around you, transference. Now, the data on transference shows that it's pretty much like less than 2%, but I like 0% when it comes to putting a potential child at risk for getting testosterone exposure. You see it once in a while in the news, a baby girl develops like clitoromegaly, or they develop like body hair, or a kid goes into puberty at a very young age because of these kinds of things. So anyone who's around young children, or taking care of young children, I never give them this thing. But for other people who don't like injections, are willing to do something on a daily basis, I think it's a great option. The next one, actually, I want to, before we get to the oral, there's other options as well, right? You have Testapel, which is the pellets. They go in your butt, and those are for long term. They last about 3 to 6 months. They're a slow release in your body. That you get a little procedure. It takes about 15-20 minutes in the office. Personally, I'm not a big fan of them. I think that you have to have a special patient for that. I think the ideal patient for that is someone who's either in like a nursing home, who can't care for themselves, or care for themselves, or can't do injections, or isn't, able to, care for themselves on a regular basis, that really just needs the testosterone anyway. I think those are good candidates for that. But I think younger guys really shouldn't be on it, because the truth is you're sore for a couple days, couple weeks, and I feel like you're not getting a better regulation of your hormone levels. I prefer to keep a more steady state with injections or gels or oral tea. So, just because I think it provides value, but there is value for certain patients, a specific kind of patient that is a good candidate for this. Now, I have people come in and say, I just want the pellets. I don't want to think about it. I just want to come in every 6 months and just know I'm being treated. And I think that's very reasonable. I'll never argue with that. But it's kind of my last resort a lot of the times, unless it's a specific kind of patient. And then the last one, as you said, is oral testosterone. And I think oral testosterone is really on the up and up. There's 3 different brands, but they all pretty much do the same thing: Talando, Kaisertrex, and Jatenzo. They're all commercial brands, so they can run a little bit more expensive. How they work is, when we were trained, the guidelines really said you shouldn't be taking any oral testosterone, because originally it was a first pass through the liver. It would cause liver injury, and we, over the last 10 years though, they've refined this, and it is not any issues anymore. It's no risk to your liver. They are great oral medication options for people who either don't want it taken, don't like injections, aren't good candidates for gels, and or just prefer oral medications in general. The medication usually peaks around 5 to 6 hours after taking it, so you have to take it twice a day. You take it once in the morning, once usually at lunchtime or at night, depending on how you want. If you need, like, instead of a coffee boost, I tell my patients you can time that however you want to do it. Like around 3 p.m., you can get a little nice boost with the second testosterone. Important for this though, you need to have fatty food with it. So you can't take it on an empty stomach. It needs to be taken with food to help it absorb into your body. And one of the actual benefits of this is, we discussed one of the risks of taking testosterone is, polycythemia, which is increasing red blood cells or increasing your blood thickness. This is actually the only testosterone option that does not increase your red blood cell thickness. So, on occasion, you have patients who are very sensitive from testosterone. Their blood thickness goes too high, and we don't want to put them at risk for other issues. So, for those patients, this is a really excellent option, and that is usually improved approved through insurance because we've shown they've failed other options that don't work for them. And this is a great option for those patients who we need to control their hematocrit, their hemoglobin levels. And you're getting the impact of the testosterone without getting the that rush of the increased hematocrit. And I think when people say, why is that? Well, I think when you're in it's a lower it's shorter acting, and so it goes more in rhythm with your physiology. When you're injecting, which usually has the highest risk of polycythemia, you have to remember you're giving your body a huge spike of testosterone, which is like a big punch saying you got to go do this, and it really stimulates your red blood cells. Whereas if you have this slow, like physiological increase in testosterone, you're probably less likely to get that. There's also some data showing that the oral testosterones are actually the only ones to improve your free testosterone by potentially decreasing your SHBG. And that we talked about SHBG a little bit last time in the last episode. But in general, it's very hard to lower SHBG. We really don't have many interventions on doing so. And this is actually potentially one of the things that can improve your testosterone by improving your not only your total T, your free T, and by lowering your SHBG. So, these are all really good options. The oral tea, because it's the newest, is the most expensive and typically the hardest one to get approved. So you have to understand that, and you might have to be willing to pay $200 a month for the medication, which for some people is worth it. Some people, you can go get a vial of testosterone cypionate at GoodRx for 3 months worth for like $35. So, like, I mean, the price differential is huge, but the important thing is we have a buffet of options to really cater to you, your needs, and what's going to work best for you.